Hello everyone, welcome you back to our YouTube channel. Today we'll be discussing about the pediatric nursing MCQ part 3. The first question is, all of the following are development assessment techniques except option A DASII, option B DDST, option C TDSC, option D MSE. The correct answer here is D, MSE, which is a mental status examination related with the psychiatry. MSE, it is the observation of a patient's present mental state and forms one part of working diagnosis. The next question is, prenatal period of growth consists of option A ovum, embryo, premature infant, option B ovum, embryo, fetus, option C ovum, fetus, birth, option D ovum and embryo. The correct answer here is B, ovum, embryo and fetus. We will be discussing in brief about the prenatal period. Prenatal period, there are three stages of prenatal period. First stage is zygote, which also known as fertilized ovum. It is from 0 to 14 days, that is 2 weeks. Next stage is embryo, that is 14 days to 8 weeks. The next stage is the fetus, which is the final stage of the prenatal period, that is from 9 weeks to birth. So prenatal period consists of B, option B, ovum, embryo and fetus. Kindly note that ovum here means fertilized ovum. Next question. Average weight gain of a neonate per day. Option A 5 to 10 gram, option B 100 to 150 gram, option C 25 to 30 gram, option D 50 to 60 gram. The average weight gain of a neonate per day is 25 to 30 gram per day. Answer is C. 25 to 30 gram per day weight increase during first to 5 to 6 months, whereas there is only 15 gram per day weight gain during the next 6 to 12 months. Kindly note this, because question might come like weight gain of neonate per day during the 5-6 months of a infant. Next question. Age in month, head circumference equal to chest circumference. Option A 3, option B 6, option 9, option C 9, option D 12, that is in months. The age in which the head circumference of a baby is equal to chest circumference is answer correct here is 12 months. At birth, the chest circumference is less than the head circumference, around to 3 centimeter. Next question. Characteristics play present among toddlers. Option A onlooker play, option B parallel play, option C associative play, option D cooperative play. The correct answer here is B, parallel play is present among toddlers. We'll be discussing brief about the various plays in various stages of childhood. During infant, that is 28 days to 1 year. Why 28 days? Because newborn or neonates from 0 to 7 days is called as early neonates, whereas 7 to 28 days is late neonates. Infant starts only from 28 days to 1 year. And the type of play which is present in infant is solitary or onlooker play. In toddlers, as is 1 to 3 years, type of play which is present is called as parallel play or therapeutic play. In preschools, that is 3 to 6 years, the type of play which is present is associative play or cooperative play. School age, that is from 6 to 10 years, is a competitive play. Next question. Caput succedaneum resolves within option A 7 days, option B 4 days, option C 8 days, option D 10 days. Correct answer here is B, 4 days. Within 4 days, caput succedaneum resolve. What is caput succedaneum? It is a diffuse edema of fetal scalp that crosses the suture line present at birth. Next question. The dilution of adrenaline used in neonates resuscitation is option A 1:10, option B 1 is to 100, option C 1 is to 1000, option D 1 is to 10,000. The dilution of adrenaline used in neonates for resuscitation. Correct answer here is D, 1 is to 10,000. Recommended IV dose for neonate is 0.01 to 0.03 milligram per kg per dose. How to dilute this adrenaline I'll be discussing in brief. Adrenaline, if we take 1 ampule, is equal to 1 mg. 1 ampule is 1 mg, and in that 1 ampule we dilute it in 9 ml saline. That is equal to 1 is the ratio is 1 is to 1000. That dose is mainly used for an adult dose, but in case of pediatric or newborn, again we have to dilute it from that already diluted adrenaline. That's already diluted 1 is to 1000. Again from that we have to take 1 ml of that diluted adrenaline. Again we have to dilute it in 9 ml saline. That is equal to 1 is to 10,000 dilution. So correct answer here is D. At birth there are how many fontanelles? 4 fontanelles, 6 fontanelles, 2 fontanelles, 8 fontanelles. Correct answer here is option B, 6 fontanelles. 6 fontanelles are present during infancy or at birth, with the most notable being the anterior and posterior fontanelles. The most common are the anterior and posterior fontanelles, and there are also 4 extra fontanelles at birth. Next question. Earliest congenital anomaly detected in. The earliest congenital anomaly detected in option A anencephaly, option B spina bifida, it should be spina bifida, option C duodenal atresia, or option D hydrocephalus. The earliest congenital anomaly is detected in anencephaly. What is anencephaly? It's a congenital absence of brain and cranial walls. Next question. Group is option A laryngotracheobronchitis, option B epiglottis, option C esophagitis, option D tonsillitis. What is a group? Group is also known as laryngotracheobronchitis. Is a type of respiratory infection that is usually caused by a virus. Group can be caused by a number of viruses including para-influenza, influenza. Rarely it is due to bacterial infection. So the correct answer here is A. Group is a laryngotracheobronchitis. Thank you. This is it for today. If you like our videos,